Okay, I don't really know much about Lassa fever because I have not been in touch with someone that has something like that. So I don't have any experience about Lassa fever.
They just said that it's just like a sickness that does not have treatment.
If let's say you get Lassa fever, if you use drug, some people will not survive, they will die.
I don't know. I'm not a doctor. I'm not a. Maybe it's a inherited something, or is a. What do I talk now?
Lassa fever is a viral hemorrhagic fever. It's caused by the Lassa virus, which is usually transmitted by rats that are, we call it Mastomys natalensis rat, the multimammate rat. We just use multimammate so that when people see you catch the rat and you see the other side of it, it has several breasts on the down part of it. So that's a multimammate rat. So when the rat passes through surfaces and it deposits urine or its feces, and somebody comes in contact, maybe you ingest food, like people that spread, if you go to some of these villages when we have high cases of Lassa fever, you see people spread gari on the ground, they spread pepper and all of these things, and somebody can just come, touch the gari and, you taste it and all. So these are sources where people get infected with the virus.
How I got infected I'm a med lab scientist by profession, yeah. So, and we're all being extra careful, handling patient sample and all that. So the care and everything was there. So I was handling a sample that has not been confirmed if the patient had. So, and one way or the other, there was a laboratory accident. I got pricked while I was trying to run a few tests on the patient. So, and with the way we were trained, when things like that happen, you just tend to clean yourself up, then you screen for all these normal other infections, hepatitis B and all that. So I did all that and there was nothing, so I got comfortable. I actually found out like a few days after I started having the symptoms. The major symptom I had was a very high fever. Well, personally, whenever I have fever, I just feel like maybe just relax, take paracetamol, and you'll be fine, which is what most people do. Okay, maybe you are stressed or malaria, just take anti-malaria, and then you'll be fine. So I had fever. In fact, when I got to the clinic, it was about 39.5 degrees fever. Then vomiting. I think those were the two major symptoms I had. Though I didn't think it was going to be Lassa fever. I just went in for malaria treatment. Not until the sample was sent to the molecular lab and the result came out.
When people contract Lassa fever, it could present like malaria. But the major symptoms we have, it's very high temperature, high fever. You have headache, severe headache is there. The face, you are seeing that is puffing, like, yeah, facial edema is part of the symptom. Some women who are pregnant with Lassa, we have seen symptoms like breast engorgement. We have seen symptoms like bleeding from orifices. Some people bleeding from the nose and other orifices of the body. A lot of symptoms are associated with Lassa fever virus.
So the fear was there. The fear was there. All through, my family members, they were all crying, they were scared and all. When the symptoms started, my sister had to stay with me, and at some point she was helping me take my bath, my mom too, and then we were eating together, like, okay, I cannot continue with the food, and she'll just continue. So immediately I was tested positive. That fear was like, my sister, my mom, like, there's every possibility that they might have been infected. But days went by and they didn't come down with any symptom. It was traumatic because it had always sounded like it's a death sentence. People are infected, they are rushing people, some people are dying, and I felt, oh, I was going to die.
From what we have seen, Lassa fever is, the viral hemorrhagic fevers generally is classified as a category 4 organism, the virus causing the disease. It's just in the same class with Ebola virus. So when people hear Ebola, they are, Ebola, but the Lassa virus is actually in the same class with Ebola. So we have mild illness, that's for sure. Even with Ebola, there are some cases where you have mild illness. But in severe disease, it's actually very bad because of involvement of organs and some other things that could be involved. So it's a very serious disease. Yes, an infected person who is showing symptoms, symptomatic person who is infected, can actually transmit the virus from one to another person when the person comes in contact with the body fluids of that infected person. So for instance, somebody is infected, vomiting, the vomitors, the blood of that person, even the urine and all of that can be infectious. So that's why we do barrier nursing for Lassa fever cases. So by barrier nursing, we mean the person has to be isolated when a case is identified, and then people that are attending to such a person will have to wear appropriate personal protective equipment. You have to be on your gown, face shield, your gloves, and all of that to attend to the cases. In the home, for instance, we encourage people to always cover their food, cover all sources of food, whether foodstuff or cooked food, cover them. And then before you use your plates, you have to make sure that the plate is properly washed. Don't say, oh, I just washed this plate last night, it's clean. And then you still go ahead and then you use the plate to eat. Your plate and spoon should always be washed. And also we tell people that things that will attract rats to the house. Some people keep dustbin in the kitchen and around their home. So we encourage people to take, when you have dustbin, make sure you empty it to a far place outside your home. And then it will not attract rats to come into the home and feed on them. And then hand washing, in most of the cases, when you wash your hand properly, because you never can tell when you have touched a surface where rats may have defecated or, so hand washing, constant and regular hand washing, it's also advised in preventing the disease. When you notice there is a rat in the house, physical elimination, you could use rat poison and then just find a way to get rid of all rats. And in the homes too, when you get to some people's home, you see holes that are made by rats. So I think people should be encouraged to make sure they block off all of those entry to rats.